Hello and welcome to your student health insurance plan with Vanderbilt University. Academic Health Plans, or AHP, is your plan administrator, and we provide the following services: a custom website specifically for Vanderbilt students, plan materials, waiver enrollment and billing services, customer care for enrollment, and on-campus support. Aetna is your insurance carrier, and they provide claims administration and customer service, distribution of ID cards, and access to a large network of providers. If you have questions or need information about your student health insurance plan, vanderbilt.myahpcare.com should be your very first stop. Here you can view plan benefits, enroll in or waive coverage, find a provider, and even view information about the telehealth services and mental health tools available to you. Your plan benefits explained. This chart is taken directly from the plan highlight flyer, which can be found on that custom Vanderbilt website under the benefits page. This gives you an overview of your maximums, deductibles, and costs for some common services you may need while enrolled in the student health insurance plan. The preferred in-network provider for Vanderbilt students is the Vanderbilt University Medical Center, where the benefits are paid at the highest tier. However, if you choose a different in-network provider, a $250 deductible will apply, and a $500 deductible will apply to any out-of-network providers you choose to visit. Your deductible will apply to many services, but is waived for doctor's visits, preventative health care, and prescription drugs. From this chart, you can see that visits to a physician or specialist have a $25 copayment. Preventative services are covered at 100%, and the copayment for prescription drugs varies based on the type of medication. For information on enrolling in the student health insurance plan, dependent coverage, qualifying events, and continuation insurance, you'll find everything you need at vanderbilt.myahpcare.com under the Enroll/Cost page. Choosing where to go for care is an important decision you will have to make. The first choice for care when you are in the local Nashville area and on campus should be the Student Health Center. Visit the Student Health Center for preventative care or treatment for routine physical conditions. Referrals are required before care is sought outside the Student Health Center. There may be times when you need care right away, but the Student Health Center is closed or you're not close by to receive that care. In this case, an urgent care center could be a good alternative for you. Urgent care centers offer same-day services that can handle a variety of medical problems that need to be treated right away but are not considered life-threatening. Telehealth is another great service for 24/7 urgent care or scheduled behavioral health visits via desktop or mobile device. Of course, if you're having a life-threatening emergency, you can visit the emergency room to get immediate care with a $100 copayment. Vanderbilt University has some incredible resources like the Student Care Coordination Office, which helps students find the support they need and connect them with appropriate mental health providers. For more information, visit vanderbilt.edu/care coordination. In addition to the Office of Care Coordination, Vanderbilt has a comprehensive student health center that provides many different services to students. From primary care to LGBTQIA healthcare, lab services, and allergy shots, these are just a few of the services that are offered at the Student Health Center. For more information and to see a full list of services available, visit vumc.org/student-health. Annual referrals per condition are required for students when care is provided outside of the Student Health Center. If a referral is not secured, your claims will be denied. There are many exceptions, such as OBGYN care, behavioral health, or if the Student Health Center is closed. Please note that dependents are not eligible to use the Student Health Center. Insurance terminology explained. Preferred Provider Organization, or PPO, is a type of health plan that contracts with medical providers to create a network of participating providers. You pay less if you use the providers that belong to the plan's network. Deductible is the amount you will pay out of pocket before the insurance company begins to pay. Copayment is a fixed dollar amount you will have to pay when services are received. Out-of-pocket maximum is the amount you will be responsible for before the insurance company begins to pay claims at 100%. Coinsurance is the percentage that the insurance company will pay for the listed services after you meet your deductible and before your out-of-pocket maximum is met. Open enrollment are dates during which you can enroll your dependents in the plan. Coverage period are the dates that your health insurance will pay your claims for the current plan year. Claim, a request for payment that you or your healthcare provider submits to Aetna when you get items or services you think are covered. Academic Emergency Services, or AES, provides you with immediate access to assistance if you experience a travel-related crisis. This includes emergency medical evacuation, medically advisable repatriation, visit by family or friends, and even lost luggage, prescription, and translation assistance. Academic Life Care, or ALC, are virtual visits 24/7 from a smartphone, computer, or other mobile device. Get immediate access to medical care whenever you are in the United States, or schedule a behavioral health visit at no cost to you. MindCheck online tools make it easy to improve your emotional well-being. You'll find tips, articles, and videos on a variety of topics that include depression, fitness, nutrition, stress, and even substance abuse. Now it's easy to take control of your emotional health. Simply go to mindchecktoday.com to get started. Cigna dental coverage can be added to your student health insurance plan for an additional cost. Most medical plans will cover accidental injuries to natural teeth, but not routine examinations, fillings, or braces. VSP vision coverage can also be added to your student health insurance plan for an additional cost. Medical insurance plans cover illnesses or diseases of the eye, but not routine exams, glasses, or contact lenses. Pediatric dental and vision care is limited to covered persons through the end of the month in which they turn 19 and is included in your medical plan. Log into your Aetna member website or access your benefits on the go by downloading the Aetna Health app. You'll get tools and resources to help you manage your health and your benefits, like finding a doctor, grabbing your digital ID card, and even ordering medication. Health Plan Pro Tips from AHP. The Vanderbilt Student Health Center should be your very first choice for physical care. The Office of Student Care Coordination should be your first choice for mental health support. Use Academic Live Care when the Student Health Center is closed. There is no referral required, and all students at Vanderbilt have access to this program. The best source for helping locate a provider is the Vanderbilt Student Care Coordination. Keep a copy of your electronic ID card easily accessible on your phone. Keep us and your school informed of any address changes. And keep receipts of all payments made for medical services and prescriptions. We hope that you've learned so much more about your student health insurance plan, but of course, if you have questions, please do not hesitate to reach out. For questions regarding enrollment information, contact Academic Health Plans by visiting vanderbilt.myahpcare.com or going to help.ahpcare.com. For questions regarding claims and benefit information, contact Aetna Student Health at 1-877-480-4161.